Hello everyone and welcome to Boundless Dentistry. In this video we'll talk about what is Kennedy's classification and then talking about the Applegate rules and then associating the two, that how Applegate rules are implemented when we are talking about Kennedy's classification and different classes of Kennedy's classification, and then talking about some modifications that are used in the Kennedy's classification, because different patients when visiting the clinic or OPD, they present with different types of arches in which there are different teeth that are missing. So let's get started. Firstly, talking about what is Kennedy's classification. Kennedy's classification is basically used in an attempt to classify partially edentulous arch, and when taking into account these edentulous arches, then removable partial denture is fabricated so that they can replace the missing teeth in respect to the areas that are missing the teeth. Now there are four basic classes in Kennedy's classification. There are two more, but mostly these four classes are most commonly used. So firstly we'll talk about class 1, which is bilateral free and saddle. Now what do we mean by this? Bilateral means being present on both sides. That's bilateral. Free end basically means that in this case, you can see in this picture, this is the area where there are no teeth present, and you can see posteriorly no teeth are present, so this is free. So this is known as free end, and saddle area is basically this area. So in this case you can see this is bilateral, present on both sides. Free end, no teeth posteriorly present, only anteriorly present, and saddle area. So class 1 is bilateral, free and saddle. Now moving on towards class 2, in this case you can see the teeth that are missing are not present bilaterally. In this case, only unilaterally the teeth are missing, and you can see there are no posteriorly teeth present to the area where there are no teeth present, but anteriorly the teeth are present. So again, this will be termed as free end, and this is the saddle area. So it is known as, in class 2, it's unilateral one side and free and saddle. So it's called as unilateral, free and saddle. Now talking about class 3, in this case you can see the area where the teeth are missing, and natural teeth are present anteriorly to it as well as posteriorly. So in this case you can see it's present unilaterally, but it's bounded anteriorly as well as posteriorly by naturally present tooth. So this is known as unilateral bounded saddle, because anteriorly teeth are present, posteriorly teeth are present, so this area is bounded, present unilaterally in this missing area where teeth are not present. So this is known as unilateral bounded saddle. Lastly, talking about class 4. Class 4 is anterior bounded saddle. In this case, you can see that the teeth are missing anteriorly, and this area is also crossing the midline, which is important in class 4. So when these teeth are present anteriorly, they are missing, and it is crossing the midline. This is known as anterior bounded saddle. Now talking about the second important topic of our video, that is Applegate's rule and its importance in Kennedy's classification. Now these are the 8 Applegate rules that are used, and it's implemented when we are determining the Kennedy's classification of any patient. So talking about each one of it, the rule 1 suggests that the classification will depend after the teeth have been extracted, not before them. So after extraction, the actual classification is determined. This is rule 1. Rule 2 simply suggests that if the third molar of a patient is missing and we are not replacing it, so it's not part of the classification. Rule 3 suggests that if the third molar is present and if we are to use it as an abutment for the support of the removable partial denture, then we consider it as a part of classification. Rule 4 is about second molar. It suggests that it's quite similar to Rule 2, but in this case it's for second molar. The Rule 4 suggests that if the second molar is missing and we are not replacing the second molar, we do not consider it as a part of the classification. Rule 5 is important. It suggests that the most posterior edentulous area of the patient always determines the classification. Now, talking about Rule 6 says that after we have determined the final classification by seeing which area of the edentulous arch is most posteriorly present, now the edentulous areas which are other than those determining the actual classification, those are termed as modification. That is Rule 6. Rule 7 says that the modifications are basically counted. We count it as the area, the number of area their teeth are missing. That is Rule 7. Now, Rule 8 suggests that when a patient comes to you in clinic with class 4 arch classification, there are no modification in it. So class 4 Kennedy's classification does not have any modification areas in it. Now talking about more details of modification, the most posterior teeth determines the classification, which is Rule 5 according to Applegate's. And Rule 1 suggests that after extraction we determine the final classification, and Rule 6 is for modification, that the actual classification that is determined by the most posteriorly edentulous areas. Other areas where there is edentulism, those are the modification, and we count the number of modification that is present in the arch. Now, after studying what is Kennedy's classification and talking about the basic classes of Kennedy's classification and modification, now we'll take a look at certain examples to clarify our concepts more. Now, on your left hand side is the first example. You can see these areas marked with red. These are the most posterior teeth in this respective arch. So these areas are the most posteriorly present, which according to Applegate is Rule 5. So these determine our classification, which in this case is class 1. Now there is also an edentulous area present anteriorly. So any other teeth which is edentulous area which is present is called as modification. So in this case this is class 1, and there is only one area where there are no teeth present, so this is modification 1. Only one area is present other than the area that is determining the classification. So this is known as class 1 modification 1. Now talking about the example on your right hand side, in this case you can see the most posterior teeth which can determine the classification is this area, which is in red. Now in this case you can see teeth is present posteriorly as well as anteriorly. So in this case this is class 3, which is unilateral bounded saddle. And you can see in this arch there are two areas where no teeth are present. So in this case we count this as 1 and 2. So two modifications are present. So we'll write it down as class 3, and since there are two area where there are no teeth present, which is edentulous area, so this will be termed as class 2. Talking about some more examples, in this picture you can see that although this can be class 4, as there is an edentulous area anteriorly which is crossing the midline, but according to Applegate's rule number 8, no modification can be associated with class 4. So in this particular example you can see this red area which is edentulous area. So this edentulous red area will determine our main classification. So in this case it will be class 3 because it's unilateral bounded saddle. Teeth are present anteriorly as well as posteriorly. So this will be class 3, and since there is only one edentulous area where there are no teeth, so this will be mod 1. Okay, so in this example you can see this red area which is the most posterior area, and this will determine our classification according to rule number 5. So this is the most posterior area. So in this case, since it's unilaterally present and there are no teeth posteriorly but teeth are present anteriorly, this will be class 2, which is unilateral free end saddle. And talking about modification, you can see two area where teeth are not present. So we have two edentulous arch. We will count it as 1 and then we count it as 2. So there are two modifications present. So which according to rule 6 we count it as two modifications. So this will be class 2 modification 2. In this particular example you can see with this red marked area, this is all edentulous area. Since there are no posterior teeth present as well as anterior teeth, this, and it is also present unilaterally, so this will be called as class 2. And then counting the other areas other than that determining the main classification, we have two other areas where no teeth are present. So we have in total two edentulous areas, 1 and 2. So this will be modification 2, since two edentulous areas are present other than that which are determining the main classification of this arch. So this will be class 2 modification 2. Now talking about our final example, in this case you can see two areas bilaterally are present, and these are the most posterior teeth, and using Applegate's rule number 5, the most posterior teeth determine our classification. So in this case bilaterally two edentulous areas are present, so this will be, according to Kennedy's classification, class 1. Now in this case you can see there is only one other edentulous area present that is determining the classification, so only one modification will be counted here. So this will be termed as modification 1. So this will be class 1 modification 1. So this was all about Kennedy's classification. What is Kennedy's classification? The four basic Kennedy's classification. Then we talked about Applegate rules and what are the different 8 Applegate rules and what does each of them mean. Then we talked about modification, and then we discussed some examples using Kennedy's classification, modification, and how Applegate rules are used when we determine Kennedy's classification. So I hope this video was useful for you. So if you like this video, please like, share, subscribe, and press the bell icon. Thank you for watching this video.